Hello, my name is Alex. I'm a BSM1 student, and today I'll be doing the oral medication administration checkoff, and here's my surroundings. Okay. And now I would log into the EMR. I would select the correct patient, and I would review the date and time of when the medication needs to be administered. It needs to be administered at 1100. And now I would review if he has any allergies. He is allergic to sulfa. And now I review the nursing locations and use appropriate clinical judgment, such as check his lab work and review vitals. And it does not appear that there are any nursing implications for furosemide, which I will be administering. And I would check these implications to make sure if it is safe and appropriate to use at this time according to his vitals and lab work. And I would know if there's any dietary needs or recommendations after that for any medication he will be administered. And after that, I will log into the AccuDose, and I will review to make sure I have the correct patient. Michael Heed, date of birth 4/24/1944, which corresponds to the EMR. And I will also check furosemide, which is the medication needs to be administered, corresponds to the EMR. And the patient's allergies, he is allergic to sulfa. And now I'll be going over the 6 rights of medication administration. I do have the correct patient, the right patient, Michael Heed, date of birth 4/24/1944, according to the EMR and AccuDose, which they match. And for the right medication, I do have on the EMR furosemide, which corresponds to the AccuDose of furosemide. And for the dosage, the EMR states he will be giving 80 milligrams of furosemide, which AccuDose states he will be giving 2 40 milligram tablets of furosemide, which equals 80 milligrams. And for the right route, according to the EMR, he'll be giving the furosemide orally. And on AccuDose, it says that furosemide is in tablets, which corresponds to will be given orally. And for the right time, it is 1100, which is when the furosemide is due. And for the right documentation, I will document after my patient has at the patient's bedside of when the medication is administered. And now I will dispense my medication. And there are 2 tablets of furosemide that are 4 milligrams each, which corresponds to the EMR order and according to the AccuDose order as well. And the tablets expire 12/22, and the packages are intact. And now I will log out of the EMR. I will log out of AccuDose. And now I'll gather all my supplies needed for my medication pass, such as my medication and my medication cup. And now we'll go over to the correct patient at bedside, and I'll introduce myself. Hello, my name is Alex. I'll be your RN today. Can you please state your name and date of birth? According to his wristband, his name is Michael Heed. Date of birth 4/24/1944. And I'll check to see if he has any allergies according to his allergy band. He is allergic to sulfa. And I've washed my hands. And today we will be administering 2 40 milligram tablets of furosemide, which will help reduce your fluid retention, which will help with it, and help with swelling caused by your congestive heart failure. And now I will log into the EMR. And I will scan my patient's wristbands, and I'll be looking at his allergy wristband as well, and he is allergic to sulfa. And now I'll be scanning the 2 40 milligram tablets. I'll scan each of the tablets, and I will adjust any dosage needed on the EMR. And now I will scan my patient's armband again. And after that, I will go over the 6 rights of medication administration. According to his wristband, he is Michael Heed, date of birth 4/24/1944, and that corresponds to the EMR. And for the right medication, I do have 2 40-milligram tablets of furosemide, which is what it needs to be administered according to the EMR. And now I will be making sure I calculate the correct dosage if needed again, just to double check, make sure the medication dosage is correct. And now I will be unwrapping the wrapper, and I'll be dispensing it in the medication cup, and I'll be using gloves if necessary. And now I'll be checking the right of route. According to the EMR, the furosemide needs to be given orally, and I do have 2 tablets of furosemide which will be given orally to my patient. And for the right time, it is 1100, which his medication is due at 1100. And for the right documentation, I will document after my patient has swallowed the tablets. And now I will be positioning my patient in upright position. I will be giving him his medication to be administered, and I'll be watching as he swallows the medication. And after that, I will document if he has not taken any of the medication or refused any of it into the EMR, and then I will scan my nurse's badge. And after that, I will just double check to make sure the time of the medication administration, and it is 1100, which is when the medication was due. And then I would make sure at that same time the documentation of the actual medication administration. And now I will log out of the EMR, and I will position my patient for comfort. I will dispose of all my supplies. I'll be giving him his call light and then add any items in reach. And I'll be putting up his side rails ×2.